Welcome back. What I want to cover in this video are the predominant types of chest x-rays out there, what position the patient has to be in for you to take the film, advantages and disadvantages of each film, as well as some other pearls here and there. Because this is a rather large topic, I'm going to break this into a few parts, and this is part one. So there are many ways to take chest x-rays, and the most common ones you'll run into are the PA frontal chest x-ray, the AP frontal chest x-ray, the lateral chest x-ray, supine chest x-ray, and lastly the decubitus chest x-ray. There are many other types still, but it'll be rare that you'll run into any of these unless you're in radiology. So let's talk a little bit about each of these types in more detail. So first up is the PA chest x-ray, or posterior anterior chest x-ray. This is really your gold standard for chest x-rays, and ideally you'll want all of your patients to take this type of film. However, you'll learn that this is not possible all the time due to circumstances such as how sick or stable a patient is. The reason we can't take PA films for everyone is that it requires the patient to be standing up. So imagine that the X-ray emitter is here, I'm going to label that for you, and that the exposure film is here, and I'm labeling that for you right now. For PA or posterior anterior films, the patient stands with his chest against the film. So the X-ray beam is hitting the patient's posterior side first, then the anterior side, before finally hitting the film. And you should be able to understand why it's called a posterior anterior film now. Because the patient is standing up, gravity helps pull the abdomen down, allowing the patient to take a nice easy big breath for us to get a good view of the chest. A PA film usually tends to be taken in combination with a lateral film. And we'll talk about that in a little bit. But the advantage of a PA film is that it will allow us to see everything we want to look at in the chest. So that includes lungs, heart, mediastinum, great vessels, bones, diaphragm, and if there's air under the diaphragm, et cetera, et cetera. The list goes on. Now, the second type of film we'll talk about is the AP, or the anterior posterior film. The AP film and PA film are very similar, but the major reason why we prefer the PA film over the AP film is that the AP film doesn't give as clear of a picture of the heart and mediastinum as the PA film, and here's why. So AP films are taken with the patient's back to the film. So the X-ray beam first hits the anterior of the patient, then the posterior side, then finally the film. This is in contrast to the PA film, in which the X-ray beam hits the posterior side first, before hitting the anterior side, and then the film. So for the AP and PA films, I want you to pay close attention to where the position of the heart and mediastinum are relative to the film. And I'm going to draw, so that's the heart in the AP film, and this is the heart in the PA film. So notice that these structures are further away from the film in the AP film. And I'm drawing the distance, let me get a different color here. And so this is the distance for the AP film of the heart from the film, and this is the distance of the PA film of the heart to the film. And notice that, again, for the PA film, it's closer. There's less of a distance, and for the AP film, it's greater. There's more of a distance. And this difference is the main reason why we prefer the PA over the AP film. While we would like to think that X-ray beams are all perfectly straight, they're not. They actually scatter a little bit. The greater the distance between the heart and the X-ray film, the more scattered there is. This is exactly like if you were to shine a flashlight at your hand to make a shadow against the wall. The closer your hand is to the wall, the sharper and smaller the image is. The further away your hand is from the wall, the more fuzzy and larger the image becomes. And so the reason we prefer a PA over AP film is that it gives us a clearer and more accurate picture of the heart and mediastinum. However, an AP film is still an acceptable film. It's just that PA films are better. Anyway, AP films AP films are usually also taken in tandem with a lateral film if possible, just like the PA film. Now, if PA films are better, why do we take AP films at all? Part of this is because the two types of films are both for the most part acceptable, but this also has to do with how stable or sick a patient is. PA films require the patient to be standing for the most part. But if a patient is too sick or unstable to stand, we will have to do an AP film instead. So if you can imagine a patient that's too sick to get out of bed, you can just raise the head of the bed, put a film behind the patient, and that's the film right there, and take the AP film. You can imagine why it would be hard to take a PA film like this, unless you're a world-class gymnast like me, or not. So we're running a little bit out of time, so I'll have to talk about the other types of chest x-rays in other videos, but here are take-home points for part 1. Number 1, PA and AP frontal chest x-rays are for the most part both acceptable, but the PA film is preferred if possible because it allows clear visualization of the heart and mediastinum. Number 2, there are times in which we are forced to take the AP film instead of a PA film, and this has to do with how sick or stable a patient is. PA films generally require the patient to be standing, while AP films can be taken with the patient sitting up in bed. And lastly, both PA and AP frontal x-rays are taken in tandem with lateral x-rays, which we'll talk about in more detail in another video. Thank you.